Telehealth is a platform that is revolutionizing the way we deliver healthcare. And it's a way for a patient to connect with their healthcare provider virtually. When we talk about website manner, we talk about what you may commonly think of as bedside manner, right? So you go see your healthcare provider and you know that's the right healthcare provider for you because of the demeanor that they have. Maybe they rest a hand on your shoulder to express empathy, or maybe it's just the way that they deliver the information to you. Well, website manner is doing the same thing, but through the use of telehealth. Telehealth is very important, and it is the future of caring for patients for multiple reasons. One, it's a way to connect with your healthcare provider. Now, this may be your primary care provider, but it's also a key way to connect with your specialty provider. I'll tell you, as a gastroenterologist, it's been a great tool for me to connect with my patients who live near, but also far, hours away, who have to travel, whether it's discussing their gastroesophageal reflux or it's discussing preventing colorectal cancer. Telehealth has provided a tool to maintain that relationship with my patients and continue to provide high quality care. For telehealth to work well, we must ensure that we cater to those who have access, the haves, and those who do not. Telehealth is a luxury that some patients don't have. There are some patients who cannot access the internet, or some patients who are unable to effectively utilize the telehealth technologies. And therein lies the problem, right? The digital divide, the chasm between those who have access to technology and broadband internet and those who don't. And for us in healthcare, this is a problem because this can exacerbate disparities that already exist amongst the elderly, amongst those who are low income, amongst those who live in rural or tribal communities, amidst those who have limited English proficiency and racial and ethnic minorities. When it comes to website manner and other strategies to improve adoption of telehealth, we have to make sure that our students, our trainees, and existing healthcare providers are trained in website manner. This is not something that comes naturally. It's not part of the typical medical school, for example, process. So we need to make sure that that is part of the process. The other thing is we need to utilize community health workers. These are people who are from the community traditionally, who have relationships with the community traditionally, who can teach people, their peers and others in the community on how to best utilize telehealth. We need to work with and partner with community serving organizations such as the American Library Association, who can provide telehealth trainings or resources to community members. And lastly, but not least, we certainly need to work at a local, state, and national level to ensure that we're meeting accommodations for those who are limited English proficiency, those with low health literacy, living with a disability, to make sure that the telehealth platforms are accommodating to them, but also that we're making broadband access available to all.